All right, so we're going to start with a neurological assessment. The neurological assessment really only needs to be done if the patient is complaining of neurological symptoms, right? So, I mean, if they don't have numbness, tingling, kind of like a fire sensation that radiates from the neck into the shoulder, down into the arm, and into the hand, then you generally won't need to do this test. I have had patients where they do have a nerve root impingement or irritation and only have local pain, but it doesn't happen very often. So the first test is a foraminal compression test, right? So again, I'm gonna just push straight down into the head, right? I'm gonna give it about 30 seconds to a minute. In most cases, we know he doesn't have neurological symptoms, so we're just gonna simulate, right? When we did this last week, it didn't create any symptoms. At that point, right, it should start to cause those symptoms to recreate. So if you recreate the patient's signs and symptoms with the radiating pain, then you have, right, a cervical radiculopathy at whatever level that the dermatomes or myotomes will relate to, right? We're not really gonna go over that. So I'm gonna follow that with a cervical decompression test. So I'm gonna come up underneath and provide traction, again, about 30 seconds to a minute. Within that time frame, it should make enough space that the symptoms become less intense, right? So again, he doesn't really have those symptoms, but that's what you would do, right? And then you would ask the patient before you did the test, right? If those signs and symptoms decrease, let me know. So again, that would indicate a cervical radiculopathy. So we're gonna move down into the plexuses now. So the brachial plexus to be specific. So the first one, or all three of these, we're gonna take a radial pulse. First one, we're gonna test for his scalene. So I'm gonna have him take a deep breath in and hold. He's gonna turn his head all the way to the left and then look up at the ceiling. And I'm looking for his radial pulse to decrease, right? So if it decreases, go ahead and breathe normal. Then we have one indication that the scalenes are irritating that nerve. So to check the opposite scalene, right, I'm gonna have him do the same thing, take a deep breath in, hold, have him turn his head all the way to the right, and then look up. You know, monitoring his pulse to see if it decreases in intensity. All right, go ahead and relax. So now we're gonna move a little bit down the chain and we're gonna check the subclavicular space, right? So the space between the clavicle and the first rib. So this one is the costoclavicular test. So I'm gonna have him retract his shoulder blades as far as they'll go and then try to touch his chin to his chest. And the same thing over a period of about 30 seconds, right? I'm looking to see if his radial pulse decreases. Go ahead, relax. Is that uncomfortable?
Yeah.
Right, so he may have some brachial plexus irritation at the subclavicular space. So the last one's actually a shoulder test. It's not part of the cervical area, but if you're doing all of those, you might as well finish with rights, right? So I'm just gonna bring the arm into flexion and abduction and external rotation until the pec minor has pulled tight. And then I'm gonna see if pec minor will impede the radial pulse. Right, so if the radial pulse decreases at any one of those points, what you're looking at is a impingement or irritation of the brachial plexus.